There was no incidence of cancer in my family. I am the first one.
I knew that I was at high risk because my mother had succumbed to breast cancer. So I started mammography early in my 30s.
I kind of had got my feet wet in the ground, used to a new country, and boom, I heard that I had cancer.
1975, I was diagnosed with breast cancer.
So for my 50th birthday present, I received the news that I too had breast cancer.
Every woman faced with a diagnosis of breast cancer has her own story and tells it in her own way. But for these women, breast cancer was only how their story began. During the past 30 years, tens of thousands of breast cancer survivors have become Reach to Recovery volunteers. They will tell you it was Reach to Recovery, not breast cancer, that changed their lives forever.
After I had my surgery in the hospital, a Reach to Recovery volunteer came in and visited with me. And I was delighted to have her come in because she was happy, healthy, and she showed me that I could have a full life after breast cancer.
Here walks in this, I called her an angel of mercy. Beautiful woman, older than I, but she was just like a light at the end of the tunnel.
Her name was Maura. I don't remember her last name. She called me, she introduced herself, and she said, "Would you like to meet?" And I opened the door, and there she was, a vision of hope for me. To see someone healthy, to see someone with hair on their head, you know, she was just a vision of hope.
Things have not always been so hopeful. No, much of the history of breast cancer in America is one of women suffering, often in suspense and almost always in silence. Until one woman broke that silence, and in reaching out to comfort others, she created Reach to Recovery.
Well, we know that Therese Lasser came up with the idea of supporting women with breast cancer in the 1950s. She began the program in New York, and after it began to have some track record and experiences and benefit, she brought it to the American Cancer Society.
And the American Cancer Society was smart enough to realize that that was an important part of our mission that we had failed to deliver on. It would be hard to exaggerate how important their impact has been on the American Cancer Society. I think of it as if research is the jewel in the crown of our discovery efforts, then surely Reach to Recovery is the jewel in our sword of hope.
Hope. The word encompasses so many facets of the American Cancer Society's Reach to Recovery program. Giving hope, receiving hope, living hope.
Whenever I have the opportunity to make a Reach to Recovery visit, it makes me realize how fragile our lives are and how important it is to make every moment count.
I want to get the word out that there are survivors out there. At Texas Tech University, I was able to share my experience with doctors, surgeons, oncology nurses, students, medical students. The reward that I have received from Reach to Recovery, it has made me a different person altogether.
You do the very best that you can do. You give the very best of yourself. And then you go away with the hope that you have made a lasting and a very positive impression.
For 30 years now, the program has flourished. Women needed it, wanted it. They made it grow. And the program is still changing to support today's breast cancer survivors and adapt to today's healthcare systems.
Women that are diagnosed with breast cancer are in the hospital for such a short period of time now, as opposed to what the treatment used to be, where they might be in for a week. And so the program Reach to Recovery needs to change so that They can meet the person wherever they need to. It may be at the site where they got their mammography, it may be in the physician's office, it may be in the outpatient surgery center.
When I first started out, we were strictly making post-op visits in the hospital. Telephone calls, for example, was an absolute no-no. Now, we're in reverse. We are making phone visits. We are trying to reach women in what we're calling early support before they have surgery.
Recently, the American Cancer Society inaugurated a national call center where anyone who needs information and help can call. This, too, is change, but one which will extend the reach of Reach to Recovery volunteers in the future.
We are now able, through our national call center, to connect people together, to match a need with a human being, a volunteer, who can help with that need.
Years and more of change, of growth, and yet the heart of the program remains the same. Although what that heart is as individual as the people touched forever by Reach to Recovery and its exceptional volunteers.
The very heart of the Reach to Recovery program, I think, is the one-on-one with the patient and the volunteer.
The volunteer is the heart of it, because we've been there and we can share some things.
I think at the heart of the Reach to Recovery program was this great vision of Therese Lasser, that she somehow understood something the rest of us didn't at that time.
It has to come from the heart. You have to know what you are feeling, what the individual is feeling.
I would say the desire to help, to spread the word that breast cancer doesn't mean death. There is life after breast cancer. And just going out and reaching out to as many women as you can.